Right, we are live. Okay, so hi everyone, and welcome to IBTM Connect. My name is David Thompson, and I am the event director for IBTM World. But today we are here to talk about Connect. And IBTM Connect is all about keeping you engaged and united as an industry as we work together to bring you the best possible content. And so I am pleased today to be joined by Jordi Estruga, the operations director for the Fira Barcelona. Now, Jordi and his team have recently carried out an in-depth study on the risk of COVID-19, which has followed with the production of comprehensive guidelines, which have been instrumental in guiding the Spanish government to reopen the venue, as well as helping guide event organisers such as myself and my team here at IBTM. So during this webinar, Jordi will detail the steps taken during the risk analysis process and the mitigation measures that are recommended to implement at the venue. So thank you all for being here, and please join me in giving a warm welcome to Jordi.
Many thanks, David. So I'll start sharing the screen to share the presentation. So, well, while I'm presenting and putting the presentation, I'm going to introduce myself. I'm the operations director, as David was saying, from Fira Barcelona, and I'll share precisely that, what we've been doing in terms of the mitigation processes and mitigation analysis from COVID. Now, let's see if I'm okay. Here we are. So, in terms of the, just a brief introduction in terms of Fira Barcelona, you know us. We are the venue from Barcelona. We have two venues in Montjuic and Gran Via. And apart from having a venue and holding guest events, we also do our own events. This is why we act as an organizer also on one side and a service provider. What we've done, so we started in April, mid-April, with a project in order to understand what the risks involved in COVID, as many of you are already doing, and more precisely try to influence the administration that at that time in April, we had no legal framework that would help us in order to differentiate our event industry and the events held in Fira and Spain from other mass gathering events, such as sports, demonstrations, concerts, and so on. So the work was done in these let's say two phases. The phase one was to focus more on that comparison and benchmarking with other sectors that would be similar, at least from the administration perspective, to show them that we were strictly different in many items, so that we were safe in order to run events. And then analyzing our events, either the produced by Fira and other guest events, and going through the risk that it's happening in the events and the mitigation activities that we were planning to do. And with that, at the end, we would end up having an action plan of countermeasures to be taken that could help to convince the administration, medical authorities, and so on, regarding our capability of doing those events. So going a bit more in detail, we work in what we call a 360-degree strategy, in which we are, let's say, not only putting actions in place, but setting a strategy that it's also making sure that those actions are being communicated, maintained, audited, and in a kind of improvement wheel, so that any interaction or anything that we need to improve, we are able to do that. So it's a process that is open to be changed, and it's flexible, as we will see later on, in order to adapt to the legal requirements that are changing nowadays, that the medical requirements that might be changing nowadays, and so on. And looking into that, into three perspectives, we've been working with AON. It's an expert company in risk management, and they are putting, let's say, the frame of how to do a proper risk analysis in a way that it's understandable and also complying with industry standards. And also they've done that in many industries, so it also helped us in compare what others were doing to make sure that our countermeasures were in line with others of high standard worldwide. Then we were working with the medical side, with one of the reference hospitals in Barcelona, and in Spain, I would say that it's Hospital Clinic, with had been providing us with epidemiological advice on the countermeasures that we were doing. We were assessing with them if it makes sense, if it should go forward or whatever. And from the business also point of view, either how we adapt those countermeasures, either medical from standard worldwide into the exhibition industry that we're doing in Fira. So things that are doing, I mean, the first step, I said, that we started working on April, was where we had no legal framework, try to compare with benchmarks, with other sectors that were similar, and we get into the conclusion that the more comparable, let's say, kind of industry that we could look upon, it was the commercial activity and malls and so on. And we should consider ourselves, in fact, we are by the law, that kind of the same activity, or we are inside the same legal requirements. And so an exhibition, it's the stands and the booths should be the shops of a mall, but with the difference that we have increased mitigation strategies, because we know who's coming. They are mainly on a B2B business, they are pre-registering, and we have lots of control of what's happening inside, so either cameras, artificial intelligence, and so on, and also the spaces and the amount of air and the volumetry that we are having, the volume of our venues, it's normally typically higher than those that are in a commercial centers. And what happened is that, at least as it happened in many countries, commercial activity was one of the first to reopen, while in business of exhibition services and so on, it's more, or either doesn't have a lockdown or lockout date, or it's later. So we did that, and we came with some comparisons that we use that to try to lobby somehow with the administration, showing them, as you can see on the left side, there's a chart that those in Spanish demonstrate on the, let's say, horizontal axis is the economical impact, and the B2B, the trade fairs B2B, are more or less on the central part of the chart on the bottom. So that would mean that the risk of transmission is lower compared to the metro, I mean, subway transport, football, cinemas, because we have either more spaces, more volume, more control, and we have a kind of a similar economical impact. But even with that, we were considered to reopen very late. So this helped. And the one on the right-hand side, it shows how the different steps of the de-escalation, so the getting out from the lockdown, we were not considered to be out of the lockdown at that stage in any point. I mean, we were one kind of the last to be unlocked. And we show them that our transmission risk was lower, but that in comparison, other sectors with a higher transmission risk were opening before. So this helped, at least from the economy side and the government economy side, to help them convince of the importance of reopening the events. And there were discussions between the economy and health administration and taking that into account. Okay. Also, what we did when we were doing all this work is try to take into account standards that were out there at that point. So we use reference documents. There's a lot of very good work done by the World Health Organization, UFI, IPC, EMECA, many industry standards that compile all the countermeasures, that many are standard, and that you will see that I think most of us are or either doing or applying to do. We're also using the legal recommendations from government. Although this is evolving and changing, we tried at all times to ensure that what we were doing was in line with what the administration was planning to apply. So in a way that if there's a final regulation, whenever this final regulation was published, it should be in agreement with we are already planning. We also did that with the medical evolution of the pandemic, either at worldwide, country level, regional level, to see what can be done, either if this is affecting the travel from different parts of the world, and so on. And with all that, we created what we called at that time, this is April, the General Contingency Plan. That was how we were thought that we should go to the administration and tell, well, this is our plan, based with all the things, with what we work and so on. This is what we're planning to do, taking into account that the situation is evolving. So that made two things. On one side, we we made sure that this plan would go changing for sure on the next month. So there was a risk committee that would be continually reevaluating the risk and changing the plan if needed. That this plan is kind of prepared for the worst case, but also that it's flexible. It's changing. And the most crucial and important thing, we know that all these countermeasures could appear to be kind of difficult, especially when we're talking with exhibitors or visitors. So we tried to make or adapt, let's say, a way of doing that in which we are doing the things, we're putting the plans, and it's more related to the venue or either the organizer. So there's a lot of work to be done, but we, in a proactive way, we plan this work to be kind of back office, so that we're putting things in place because the exhibitors and visitors need to do many small things. I mean, wearing a mask, yes, but we're not planning to change, let's say, layouts. Either we're not planning to change design of the stands. In any cases, to adapt whatever countermeasures or additional countermeasures to make sure that the events can be done without major impact for exhibitors and visitors. I'll try to show you that throughout the presentation. So how we started that? So we first analyzed what it would be from the user experience. So either from the visitor and attendee experience, what are the main processes that they are taking into account when they interact with us in a trade fair, event, or whatever. So that are those 60 processes that takes place either in the build-up phase or tear down, or either in exhibition, I mean the opening days, and covers as many aspects as when I'm parking in a parking, or arriving in a metro, or control access, or buying a ticket, or going to a toilet, using an elevator, an escalator, going to a vending machine, etc. So we've tried to be as much open as possible to try to collect as many processes as possible, and that's a range of 60. But again, we are planning with that 60 processes to try to do an integrated and overall strategy of reduction, that if later on there's a 61 process or 62 process, the countermeasure that we've defined would be applicable for those processes and any other additional process that might appear. And for each of those processes, we were looking into the three main risks that we've learned from the discussions with the medical teams. There are mainly, as we know, the person-to-person. So when two people are interacting, that's the most critical risk, and that's what we more need to tackle. Then there's the SMID infection, or person-to-object, that throughout the months, it has shown that this is important, but it's from a different level of importance compared to the person-to-person. And there's also the airborne transmission. That there are also different studies, and there's a lot of work done in this area, but it seems that this is, in comparison, in a lower level of risk compared to the person-to-person. In any way, we've tackled the three of them. So for each of those 60 processes, we split that process into the different steps that were composing that process. And here is an example, though it's in Spanish, but it's clear to understand. It's the parking service. So when I'm talking about parking, it's I'm getting to the car, I'm arriving into the gantry system, I'm taking the ticket, I'm driving inside the parking with my car, then I'm parking, I'm going out of my car, I'm walking. So that's, I'm paying in the cash machine and so on. That's those 15, 18 points or steps that makes this service. And for each of those steps, we analyze if there's interaction, either person-to-person, person-to-object, or error transmission. And based on the number of interactions, we value the risk. So if the chances that you are crossing lots of times with other attendees in the parking, then the risk will be medium to high. And also regarding the time of interaction. So if you're paying maybe on the cashier machine or with a ticket office, and you're interacting with someone in the parking, that might take long time. If you're only crossing with someone who's also looking for his car, the time is low, therefore the level of risk is lower. Okay, so we try to get into that level of detail. So, and for each of those potential interactions, we set kind of a methodology. We try to apply kind of, based also in a matter with some of lean management. So it's a matter of, for each interaction, thinking, okay, the interaction is safe nowadays, getting the example of the parking. Driving inside the parking, inside your car, that's supposed to be safe. because administration allows you to do so. There's no risk of interaction. You're protected by your window, so you can keep that. Now, if for whatever reason the interaction is not safe, we suggest that you might think of eliminating that. That's a tricky part, because many of the things are substantial to our activity, and you cannot eliminate that. I mean, we are doing conferences, you cannot eliminate the conference. But for example, if you're giving brochures, if you're giving candies to your visitors, well, it might be worth eliminating those interactions. So if you can, eliminate as a simple thing. If not, try to digitalize. So that means if you need to interact to get information, well, rather than going and interacting live with another customer or another maybe hostess, for example, you should check the information maybe in the website or in an app. Or maybe we promote that you are doing the online registration or you're doing online payment. So everything that can be done online, it's avoiding interaction. So that's safe. Even doing that, we won't be able to digitalize everything. So therefore, we will need for sure to put some separation. And that separation includes either physical distance, so ensuring the 2 meters, then it was 1.5 meters. So this has been evolving. But whatever physical distance, it's, let's say, determined to keep that. It's also a matter of putting screens. So screens in the places where there's an interaction. And it's also a matter of trying to distribute the people in a way that you're not getting queues. So that would say the demand, try to play with the demand side. So if you're selling tickets, try to sell them in by scheduling hours, different frames to visit, for example, or try to make the main, if you're doing, for example, a training, try to do that training into 2 different items. So in a way that you're more or less making sure that there's not big peaks in certain moments of time. Once we've done that, even in that, there might be some interactions because there's people there that might be potential positives in COVID. So that's why we talk about screening. Screening is doing things to make sure that people, potential positives, are not going to the venue. So that means either from establishing controls on the registration system, could be controls for incoming countries, for example. Certain countries might be banned, the transport. It could be biological passport. We've assessed that also. At this stage, we're not prepared to do that as a country, but it's something that it's also looked upon. Doing tests on site, but we discarded that because the time of the test, it normally takes time and 2 weeks or 1 week, and that could get positive also. And we look into, for example, the option of measuring temperature. So on temperature, we know that it's not 100% effective because the people without symptoms are not being detected, but it's also a thing that provides back confidence to some of the attendees. So this is something that we're looking into. And more important, we worked to try to put a system of tracing context. So what we said when we went into the administration, and more precisely for the events organized in Fira, that we would be putting our system of lead retrieval as something that we would be using in all our events as a compulsory, in a way that every attendee who's going to visit the booth needs to be registered with that system. Maybe typically it's an app in a mobile phone that we deliver to exhibitors. They scan let's say they scan the badge of the attendee. Therefore, we know which attendees have visited which booths at which time. And if days on the next day or the afternoon, we know that someone is positive, we can trace down and go to the health authorities and say, well, this person has been in this booth, this booth, this booth, and has been in contact at that same time with those people. So, and that has helped us, or seen very positive from the administration side and the Health and Safety Administration, as we are providing a lot more of controls compared with other peers, as could be the malls or commercial activities. After done that, even with that, we won't be able to 100% avoid that anyone can come because they can have no symptoms, for example. Then we enter into the protection phase. So we need to put hygiene, so that the sanitizers, it's also a matter of cleaning, doing additional trainings and so on. So that's the protection. And all those strategies are followed by 2 main strategies that are information. It's complementing, but it's a matter of showing and sharing this information with exhibitors, stand builders, attendees, and so on, before the event, during the event, and supervision. I mean, to supervise all what we are doing. either controls, audits, automatic systems, making kind of scorecard or information that we can handle. So we analyzed 60 processes, 940 countermeasures. From those, we try to tackle that, and as is a lot of information, we try to group them. So as many of any of those 940 countermeasures appeared, use mask, use mask, use mask, we grouped that, and then we knew that we did not need to work on 940 initiatives, but in that case, it was about 60 different initiatives. And even to go a bit further with that, we grouped those in categories, let's say, in what we call 20 projects. Those 20 projects talk about what things will Fira do, either in infrastructure, either in changing the internal procedures, that will remain for all the events, either own events, either guest events. So that means that if we are, I don't know, putting screens, the transparent screens in all our customer service points, this is going to be fixed for all events. If we are putting additional signage, this is going to be there for all the events, and so on. But some others are, as said, changing the procedures. So if we are changing the contracts, for example, this will also be there and will be applicable for all our events. But some might be things that are recommendations, and is where we talk about doing what we call the guidelines that help organizers and exhibitors, but mainly organizers, to plan their event in a way that might reduce, that it's entitled to reduce the risk of COVID transmission. Okay, so some of the things, and being fast, so we've done those design guides that then we'll have the chance to review them. We've changed in all our food and beverage points, the more than 50 restaurants in our venues, to review them and make sure that they are following the protocols and they have additional strategy, additional signage, screens, and so on. Digitalizing, what we've done is try to reduce the person-to-object interaction. So therefore, we've seen that there are 4 main interactions. Let's say that in our industry, there are lots of batch. So we are planning our events to be batchless. So let's say we are avoiding giving lanyards and promoting that people, at least in September, October, they are using the badge in the phone. This is more to give confidence back and more to inform the authorities that we're doing things in a different way and reducing this interaction. So badge, let's say mobile badge is one of the items. Cashless interactions, so making sure that all the points that we're using are, in coffee points and so on, are being paid without cash, so or with a credit card. And then we're also looking into the paperless interaction. So it wouldn't make sense that we recommend our organizers and our exhibitors to try to avoid giving vouchers if possible, but we will be the first to provide with vouchers. So all the information that we're providing, we're planning to do that using QR codes. So we eliminate that. And then we look into small options of doing other touchless things, so that you can, for example, maybe in the lifts, you can, let's say, call the lift with no need of touching the button, this kind of thing that they are still under analysis. Then in terms of separate, we've analyzed the people flow and capacities. And mainly what we get into the conclusion is that we are not planning to change the layout or the design of the stands. What we're saying is that we look into the options of flow in our aisles. And what we saw after doing options is that we could analyze and we try to test the IKEA flow. So going, in one sense, following all the aisles in an event, but that's a huge, a long distance to walk. So we discarded that. Then putting one sense of direction, it's also something that we analyze, but what we've seen is that as for pedestrians, it's very difficult to control. And if you're talking about 10,000, 20,000, many people will not follow that single direction. So we turn into the optimal solution for us, that is going to be keeping the aisles as they are, but making right direction sense. Okay, so you always try to work through the right. It's also 2 senses of direction, but trying to promote the right side. So either right signage system, signage, and so on, try to promote that. So physical distance, as said, is going to be put in the messages, what we're doing, in displayed, inform, and so on, putting those transparent screens. I said all about the screening and the handling of positives. And here we look into the, for sure, COVID will change or might change the access protocols that we're following. So before, let's say we were checking that someone was an attendee, and then, okay, we look into your badge, then we read your badge, you're in. Now we might incorporate the control of the mask and the control of the temperature in between. Well, how to do that, it's kind of crucial. So what we've seen is that we need to first ensure that someone is an attendee, so scan or see that, let's say, either visually that they go to the event, or that they have a mobile badge or whatever. But then the first thing that we need to do is to ensure that they wear the mask, and then take temperature. Because if we do the other way around, we would be screening someone with temperature that could be positive, and then it might result that he's had a fever and is not wearing a mask. So it's kind of changed things. So let's say, check that it's an attendee, put sanitizer so that the hands are clean, give them a mask if he's not wearing, and then check the temperature. And to do that, you need to make sure that the flows are okay with that. You need to leave some space to do that. I mean, it's a venue organizer thing, but from the visitor's perspective, it's as simple as bring a mask whenever you go to the event. Then all the use of personal protection equipment, we've done that, we've reviewed that. We also analyze the air renovation, the use of UVC assistance to clean the environment. What we've seen is that mainly it's a super investment, and the critical factor is the amount of air, of external air that is entering into the venue. So it's a matter of more increasing that amount of external air to make sure that inside the venue, the conditions are very similar to outside. So we've also analyzed that and worked with the medical authorities, and we are getting into that the thing. Again, we'll do some filters and some UVC. We might do that, but in very focused and located areas. But for the general vision, we're more promoting the use of increasing the amount of external air. And then all communication and supervision. Okay. So as a result of all those projects, let's say, or all these things, we end up on the left-hand side with 20 projects. Those are the projects that I've just shown you. So on these projects, talk about actions that we're doing, and again, that we plan to keep in Fira for as long as the COVID situation lasts. Okay, so that would be either changing regulations, contracts, and these kind of things. And then we talked about those 3 guidelines. That mainly is a guideline for organizers with, let's say, recommendations and some things that are requested to be compulsory based on what the law is requiring today. Again, the same for exhibitors, mainly focused in the event that Fira is handling. And then for visitors, although for visitors, it's more kind of, more than a guideline of things to do, it's more a communication of what they might expect when they arrive to Fira and what they might see when they arrive to Fira, so that they can envision how the events will look like in the forthcoming months. And with that, we created what we call the contingency plan for the shows that were called for September. So this is how the organizers' guidelines look. I'll then step into detail, so you can I'll share that in more detail. But again, it's try to help the organizer to think about that methodology. So when you're doing an event, think about what you can keep, what you might eliminate, what you might digitalize, separate, and so on. And there's some controversial areas. For example, as digitalizing, it's obvious that the conferences is an essential part of our business. So what we're saying is, no, that's crucial. The meetings with your customers are crucial too. We're not planning you to digitalize that, so you can keep it. But maybe if you, on top of doing the on-site presentation, you're adding some, let's say, some audience online, that might help for your event. Or if you're doing meetings, either staff meetings, or you're doing training for your staff on site, maybe you can consider to do those trainings online, as we're doing nowadays, either through webinars and so on. But there are kind of guidelines. I mean, it's a matter of, we try to be flexible and provide as many information, because we also understand that either organizers and exhibitors have different sensitivities. And one might be very willing to cover and have a lot of countermeasures because he's on the purpose to make sure that everyone is safe. Others might see those countermeasures as a pushback for the event. So it might say, well, we're providing those information, those guidelines, and you feel free to, with that recommendation, build what is going to be your own experience. Again, this is the same as exhibitors, and set use. You can see here the example, because this is the guidelines that we're sending for our events. For organizers, we share the organizer's part, and we let the organizer to include whatever he considered from that guideline inside the planning of their event. And for attendees, again, it's sharing that, more than a guideline of things to do, that we are still working into that. It's more of what they might expect when they arrive. So let's say when you see an event, you might see that the exhibition space follow the design and operation guide in order to reduce risk, that the venue discourages the distribution of deliverable materials, that we are promoting the online registration, for example, that we complement physical activities with digital activities to improve user experience. We are promoting as much as possible the cashless payment and the online ordering system in order to reduce queues and in order to reduce interactions person to person on site. Try to reinforce accesses. So we said, well, if you can increase the number of access, you might get fewer queues, or if you're adding more staff in the accesses, or you're, let's say, promoting that the entrances are done in different time schedules, you might be able to, let's say, do a demand that is more stable and reduce queues or peaks, okay? But these are suggestions. That the attendee flows, as said, are managed in an orderly manner and making sure that people, it's promoting the sense of direction into the right, that the spaces have been redesigned to guarantee physical distance, and floor capacity with automatic control. So regarding floor capacity, this is also an important point that then will appear on the guideline, is that from the, let's say, health point of view and from the legal point of view, let's say everyone should have 2.5 square meters, 4 square meters, whatever space that it's allowed by law. And an event would be, in an ideal world, made by spots of 4 square meters where in every spot there's one person. But that's obviously nonsense. I mean, we cannot do it in that way. But what we try to do is, okay, let's ensure with the authorities that we comply with that space at 3 levels. So at one level is that the amount of space that is in the event, it's capable to handle the number of attendees that are at every single time, and that everyone has at minimum those 3 meters, 4 meters, or whatever space that is requested by the administration. So that means that if I have an event of 10,000 square meters gross, and I'm having 2,000 people at one certain time, and I'm able of measuring how many people I have precisely in a certain time, I can tell that on average, I'm providing 5 square meters per person. So I'm complying overall with that. So at let's say a macro level, I'm fine. But then you can have some queues at some point. Then is where we moved into putting some additional systems. So we'll be measuring Wi-Fi, and through the Wi-Fi network, we can know how many devices are located in one certain point. So we have a very good indication if there's a queue there or not. Though the only thing is that this is very sensitive to the ratio of devices per person. And this ratio is not exact. We know that might be 1.5, but we don't know it by heart because we are not measuring the number of devices event after event. So that's why we need to complement this measure with a real-time, precise information of how many attendees are inside the venue. And this can be complemented with 2 additional measures. The one, it's measuring with cameras and artificial intelligence, the capacity and the flow rate in the main crossings, where do we know that there's a large amount of people. And this can let us know that we are not going above that standard space per person. So that's also good. And also this is complemented with, or might be complemented with, what we call the capacity in the stands or capacity in the conference rooms, for example. So let's say that we have a very good 3-4 systems that allow us to ensure and monitor that we are complying with that, let's say, rule of how many space per people in all areas, okay? So having said that, we move into the point number 9, when we'll be developing with the see-through screens all around the venue, the measuring of individual temperature screening, as said, the tracing of the commercial context, also as said, with that lead retrieval system, and with the medical points has been also reinforced, where the attendees will be wearing protective mask, hand sanitizers will be available throughout the venue, that we have high frequency contact points are increased the cleaning of those points, either because we have more people cleaning them or either because we are avoiding them. I mean, if one of the high frequency contact points is a door, we might keep that door open, so it's no longer needed to open it, okay? As said about the UVC, that has been reviewed and analyzed, and all what said about food and beverage that will be applied in all the catering restaurants and outlets. So we'll be increasing the reinforced signage, and we'll be training personnel either through the guidelines that we're sharing, either the contract that we're putting in place, but also putting additional training facilities, let's say. So in every training or briefing that we're doing before the event, we will be ensuring that this is also included. And that we will have a supervision system permanent to make sure that all the countermeasures that we are saying that we will apply will be applied. And in fact, this will be done and audited by a third party, different to any of the parties that helped us to develop those guidelines. So to make sure that who's auditing is not the one who has developed the countermeasure. So we have a kind of an additional control. So as said, this has been done with the collaboration of our own and clinic. And now I would try to share you the guidelines of organizer. So let's see if I'm able of doing that. Okay. Okay, so I hope you can see it. So what we say here is that guideline. So again, it's the same as what we've been discussing. It's about a 25-page document where we explain the same principles, those 8 principles. It's, again, it's focused or the goal is that the organizers can keep that on the initial phase of designing the event so that they can think about those items. So for example, here it talks about, well, about those strategies, about the measures that Fira has implemented or is planning to implement in their venues, signage and so on, the training, all what I've been already explaining. And here we get into more detail of that guideline. So for example, maintain, it's easy, but then eliminate. So we start thinking, well, let's question if the things that you're planning are necessary. So if you're doing things that are non-essential, try to eliminate that. If you're doing brochures or catalogs, maybe you could do that on online world, okay? If you're doing activities with a lot of number of visitors, well, think about that, or try to think if they are necessary or if you can do them on a different way, meetings and so on. And then try to focus on queues. And we know that the queues, for example, providing free products is a queue maker. So try to regulate that. Increase the service capacity to 10 visitors at the peak times, reduce the demand. So try to influence in your visitors pattern, selling tickets in different time schedules, these kind of things. Then the personnel, well, try to reduce the number of personnel if you can, try to reduce the working hours, promote the meetings, question the material to be handed out, incorporate criteria to eliminate interactions in the event design. So maybe you're planning to do an installation that is not an exhibitor's installation, it's only an event organizer installation. Well, that you're promoting a lot of interaction there, well, you might think to do that something differently. Then in terms of digitalize, again, so here is try to reduce or eliminate paper. So try to promote things, replace paper. If we talk about the exhibitors and visitors, try to prepare them or incentivize that they are making pictures of the business cards, for example, instead of exchanging them. Promote online registration, promote the online procurement of systems. Again, try to change the face-to-face meetings to other solutions and so on. In terms of separation, again, we talk about density and people density measurement systems, as said, at macro level. So it's good to have a real-time information of who's entering in the venue at a certain time and divide that between the total gross surface. So you can ensure that on average, people has the amount of space that they require, but then it's good to have that at intermediate level. So either density measurement through Wi-Fi or whatever. And micro level also, try to put those systems that it's easy to have. So it will be measurement or access control system in the conference and meeting rooms, for example, and these kind of things. So what we're planning, again, is not to change the design, and we don't plan to change the layout of things, but it's only that try to adapt the current layout or design to the current capacity that it's fixed by the administration. And elements that reduce the risk, well, number of people, the more risk, the more density, the greater risk. So things that you could do are reduce the number of people, if possible, increase the number of space. So if you're planning to do an event and you have extra free space on the border of the hall, you might consider to increase the space and put a little bit more of carpet to try to reduce the density, but that's an option. And type of flow, as said, type of flow, going to an order flow, it's less risk than in a disordered flow. So whatever you can do to order the flows, the better. And in terms of queue management, well, from the theoretical point of view, it's a matter of reduce the, I mean, there are things that you can do. So reduce the number of people or increase the capacity. So here, talking about the spaces, how to look into the spaces on the conference and meeting rooms, how to design the orderly flows, as said, increase the number of entrances, define entrance and exit points that are different, the routes, as said, the two-way aisle model thing that can help. It's not a compulsory thing, but it's a recommendation that we're doing for our organizers and for our own events. So eliminate the queues. So to eliminate the queues, we say, well, things that you can do to eliminate queues. So change and go to digital as many as possible, distribute visitors. And if you are not able to reduce the queues, manage them properly so that they have the social distance and so on. So for example, it would be good to try to get kind of prior appointment system overall, so that the more that you can know how many people you might expect, the more you can prepare your capacity to cope with that demand. If you're facing an unexpected demand at some point, a lot of people can arrive, well, it's difficult. So that's why we're recommending not to sell tickets on site, for example. So try to know as many as possible who's coming before to the event, these kind of things. So capacity, we also put some points of capacity here. In Spain, in Catalonia, sorry, from the 18th of June, regulation, and after all this work, allowed us to do events, ensuring that we are keeping at least 2.5 square meters per person. And we can even go below that, but making sure that everyone is wearing a mask at all times. So this might change. So we're also flexible in this point. And what we're putting now here as a attention icon is because this is currently what the administration is saying. If it changes, we should be changing that. So more things. So the screens, where to put the screens, mobility and transport, try to redistribute people, put signage that is suitable. Then about the screening, as said, well, we considered different screening criteria. So either by country of origin, health certificate, body temperature, not wearing a PPE. We need to prepare with that. And also either by not cooperating. So we thought about what happens if someone is not cooperating in the venue. So if someone arrives and is not willing to cooperate, typically a security guard would go there. If in the entrance, someone is not willing to put a mask or is not willing to take the temperature, should be treated as a potential positive. So we would need to have already, let's say, security guards wearing, let's say, all the PPEs that are appropriate to go and track and handle that person in time. So they don't need to put the PPEs at that time. So they might already be wearing that. So are some of the things that we're considering. Also, in terms of emergency, now it's typical when there's a fire that people is meeting in a gathering point. Well, now those gathering points, either they need to comply with the physical distance, or we should need to create more gathering points. So these are something that we are also considering. So making sure that these things are also including in the terms and conditions, either of the suppliers, for example, they need to screen themselves before going to the event to make sure that they don't feel with symptoms. And as this is a kind of a scheme of how to follow that procedure, no? So we first check that people it's going to the event, then putting the hand hygiene, then putting the mask, and then measuring temperature. Otherwise, we would be messing it up a little bit. So more visual controls, doing sanitization. It's also important, and that's more based on what the medicals are saying, it's to reinforce the use of hand sanitizer more than gloves, because gloves tend to bring the sensation that you are overprotected, and you then might not be touched your face with the glove. So it's more important to have a frequent hand cleaning, and we try to put that into the guidelines also. So temperature control, as said. Also, we are asking the organizer that they should put in the regulation that their attendees or the exhibitors could measure the temperature to make sure that if they have a fever, they're not go to the event. Well, that's kind of common sense, but it's worth to be included here. So the management of positive, as said. Then protection. So we talk about the PPEs, the face masks, the use of hand sanitizers. Try to perform the activities outdoor as even as possible or in open areas, more than in enclosed areas. Supply face masks could be done, but should not be in exchange of not using a mask. So it's a complementary thing. The face shield and mask should be a complement thing. So again, the same with gloves and these kind of things. Then in terms of hygiene, worth mentioning the food. What we have analyzed also in terms of food is that food is safe is if it's well prepared. So that would be handled or done by someone who's already certified, and this can already delivered in a single package. So we will be delivering food in single package, and this can be eaten later on, but we are forbidding all kind of, let's say, bulk food delivery. Okay, coffee and tea would preferably be served in disposable cups and these kind of things. Okay, so again, tasting of products. It's we understand that many exhibitors are delivering products. They are producing products to taste, so it's okay to deliver that. But if you're only doing sweets or whatever, well, we should refrain of doing that if possible. Okay. Then the supply of gel, will be putting about more than 200 stations or 150 stations of supply of gel in the venues, but we are also putting some guidelines of where the organizers could put additional supply of gel. We'll also be putting vending machines in the venue with gels and face masks and so on, so that if someone is not wearing, they can go to the vending machine. Then we talk about cleaning. Yeah, we look about cleaning of stands on one side, cleaning of surfaces, because it's one of the things that is also important to clean. We talk about the cleaning of products in display, and then communication, how we can communicate. So either through the guidelines, through all the available communication channels, putting that information beforehand for exhibitors, and doing trainings. And one of the things that we're trying to put is signage also. We are putting recommendations of signage that can be done in the venue. So we are already doing signage. We're already producing signage that will be fixed in the venue. And we have already those logos of signage available to organizers in case they would like to include that same logo in the messages or in the signage that they're producing for the event. And here are some of the examples. No, either maintain the physical distance, preferred use of lifts, etc. And trying to advise that this is good to make it in a friendly manner. It's more about emphasizing terms as prevent more than forbidding. I mean, we don't want that to be full of red signs of crosses, but more kind of positive messages. Okay, and the supervising, although again, it's mainly going to be done by the venue with those artificial intelligence and scorecard of systems and so on. But for example, if we want to avoid queues in the aisles, let's say that the delivering of free deliverables is forbidden in an event. Imagine that. If there's a queue that's happening because there's an exhibitor who's handling a lot of products or too many products, and this is creating a queue, it's a common effort from our side, because we can see, we can detect, but at some point, the organizer might go to the exhibitor and say, well, please, there's a queue being made over there. Could you refrain of delivering those free packages or whatever for the next minutes or whatever until the queue has been reduced? Or can you deliver them in another way that is not creating the queue, etc. Okay, so that's a guideline for organizers. That's 26 pages. The exhibitor one is the same information, but extracting many of the information that is for organizer. And I'm not sharing it because it's mainly the same, and because it's more focused on our own events. As said, the organizers with these guidelines are those who are deciding what of that information they are willing to include or not in the manuals that they are using with their exhibitors. So that was all in terms of presentation. So I have some questions over there. So yes, I'm seeing some questions posted here. We are doing our first event. I mean, when will be our first show and how many people will be allowed? First event, physical, is going to be mid-end of September. It's an own event by Fira. It's about entrepreneurs and and it's not too much, about 2,000 people more or less. And it's co-organized by the city council, so that's why we are kind of confident that it will happen, and we'll be putting in place all these countermeasures. We will also use this event as a, let's say, as an image to show what we are planning to do and how our events will look like. Okay. Okay. About if we are going to measure guest temperatures, or should the organizers make sure this will be done at the entrance? Well, this is one of the items, the temperature measure. I mean, the temperature measurement that is not compulsory by law. That's one side. And on the second side, we know that it's not 100% effective because all the asymptomatic are not being detected. So we think of it kind of a thing that helps to build confidence. Therefore, this is something that organizers might decide to do. We'll be doing that in September for our own shows. But what we foresee is that this might turn into something that we do at the beginning. So people, it's like going back to the mall. Now they get used to it, and then we might be able to don't do that on the forthcoming months. Okay. Again, it's an organizer's decision in this case. So, and we can provide the service, and let's say, I would recommend that it's good to do that maybe in September, October, November. I don't know. It will depend also on how things evolve. Do you propose to have fresh air ventilation via doors, windows, or fresh air system, or will all ventilation be via motorized air handling units? Okay. Ventilation. Our system, the system in place, the pipes, the system, and so on, gets air, a normal condition, pre-COVID, gets air from the outside, cools it down, and then exhales a little bit of hot air into the outside. In normal conditions, let's say, I'm not an expert, but we might be using, I don't know, 5%, 10% of external air. We do that because cooling, I mean, the external air needs a bigger temperature drop. Therefore, using a small amount of air makes some renovation of air, but it's very effective in terms of temperature and comfort. We will be increasing that in 10, 20, 30, 50% in a way that the system is already there. It's only a matter of opening the valve more, so there's more external air entering. So we have more renovation of air. So that's it. We don't plan to install additional systems. We might do that or rent some UVCs for some specific areas, but not overall in the venue. Okay, badges. Okay, regarding the badges in the booth, what we are planning is not, I mean, the question is how we can retrace who was on our booth without scanning the context. Well, what we're looking is to what we call the commercial context. So context that takes 10, 15 minutes. Because this is when you're positive and you go to a hospital, and if they go to the contact tracers, they will be asking you with whom have you interacted on the past day. That takes more than 15 minutes. We're not talking about crossing someone in the street. It's that you've been talking with someone, eating with someone, and so on. So we are asking exhibitors to trace or measure and do lead retrieval with those visitors with whom they are meeting. Okay. Now, that's the only way. And if you're not using that system, we're open, and we put that in the guideline, that you can have a list. So, okay, you're registering. So you're taking note of who's there, contact details, and so on. The only disadvantage of that is that if it's a lead retrieval system managed by the venue, the organizer, all information is centralized. And if there's a positive, we can really ready and easily check where that positive has been working or talking with. If not, we will have 500 spreadsheets from 500 exhibitors, and we cannot give the name of the positive to all exhibitors because we would be disclosing information. So we need to trace a potential positive with 500 Excel list or whatever from exhibitors. That's why, well, we rather suggest to have one integrated overall system. Okay. Wearing mask is very well, but a mask is only 6. Okay. About the mask and the change of mask and so on. There might be some medical advice and different advice. Now, we are trying to follow what the administration is telling. Now, administration tells that it's compulsory to wear a mask to enter into the public spaces, and a venue would be that. But it's not so far regulating from the administration point of view that the masks need to be worn for 6 hours or whatever. Typically, they last short when they are, let's say, used or they are in a risk environment. And I understand from the medical perspective that this is very crucial from doctors that they change that. Now, legally, you need to wear a mask, but there's no mechanism to control if you do that, if you change it or not. I mean, what we consider is that wearing a mask is better than not wearing a mask. And maybe if you're wearing it for 8 hours and not 6, okay, maybe 8 hours is not as good as exchanging every 6, but it's much better than not wearing a mask. So we are not planning to check the time that everyone is wearing a mask, but making sure that everyone is wearing a mask, okay? Another one, measures aimed at supporting organizers with persuading the sponsors, exhibitors that the event will be successful. And yes, well, what we're doing is sorry, I'm gonna read it back again. I wondered if Fira are taking any specific measures aimed at supporting organizers with persuading their sponsor exhibitors that the event will be successful. What we're doing is sharing, or things like we're doing today here. It's sharing the information, sharing the guidelines, saying that those guidelines are trying to be practical and complying with the administration, complying with the medical advice, but being in a way that are effortless and costless for exhibitors, and that we are putting all our confidence that all this is it's good and it's going to mitigate risk because we have so many people backing it up. Now, it's a difficult time, I understand, for organizers going to exhibitors because there are lots of concerns about that. So we are putting all our proactivity to help them do that, and we are going and assisting them and explaining them what we are doing, and doing our own events in September will also help to have some video material, pictures of how it look like. I mean, I think that we all need to see real going on in Europe and see events going on, and this, I think, is going to be a very step forward to be able to gain or overcome all the potential concern that might be appearing today. 7, the press here in the UK say that they are forgetting about recycling plastic waste because of COVID. Will all the food and drinks be sold in recyclable containers? Okay, it's a good point. So let's say now we're focusing on being able to overcome COVID, but at the same time, we are also working towards sustainability. Many things we might be able to do them together. So using plastic that is reusable, it's good. We already have it. We have materials that are done by organic waste and so on. This is all already there. The truth is that some other things will go against sustainability because we might be using more plastic, the same PPEs, the same gloves, and so on. So for sure, we will try to get a balance. My perspective, we are now focusing on recovering from the lockdown, and at the same time being able to provide that in a way that it's sustainable too. Okay. Okay, if we notice too many people gathering at the same place, how we would react? Well, from my perspective, one of the things that we need to do is to make sure that this is not happening, or that we put countermeasures in place prior to that, before that. So opening more accesses, having more queues, I mean, more people, and dividing the slots, no? Making sure, I mean, putting all those mechanisms will help us to reduce the amount of queues. Then once the queue happens, well, we've done that, and I think that all in the event industry are knowledgeable about that. Well, try to go into the cause or identify the cause of that and try to handle it. I mean, again, the queue is created because there's a lot of free material given. So go to exhibitor and avoid them that they are delivering that free material. Because there's a lack of people and we need additional resources, we'll get people from other parts to increase the resource, either in the, I don't know, if it's a cloakroom, putting more people from the info points going to the cloakroom. If not, closing the facilities. I mean, the good thing is that we have information in place. We try to do as many things as possible in advance. And at that point, try to react, going to the root cause and try to put our best mechanism to reduce that queue. Last question. Okay. Yes, if I can share the guidelines and presentation, yeah, sure. We will do that. There's the blog of IBTM. So we'll make sure that in the forthcoming days, either today or tomorrow, this either presentation and guidelines are on demand on the IBTM blog. Okay. Toilet area. It's a delicate space. How are you managing this area related to cleaning, allowing people to enter? Okay. So in toilet areas, what we are planning is to do what we call the sanitization. So it's a special cleaning, so where they enter at night and they put kind of droplets. I mean, the disinfective material, but in steam or in air, so that they are able to go to all of the small parts of the toilet. This is going to be done at night. In terms of capacities, we'll put in place social distance. So in men's urinators, for example, it's going to be available, not available, available, not available. then we might put some messages of keep the social distance or physical distance. Now, it's also a matter of that people comply with that. And there's another point that is positive about the toilets is that cleaning hands is one of the crucial countermeasures. So supposedly everyone going out from the toilet supposedly should have the hands clean. So either if you're maybe interacting with someone just before, if you're keeping the social distance but you're touching something, at the end of your toilet experience, you should have your hands clean, and that would work to a safe experience. So I think that I've answered all the questions so far. So if there's no one and we're on time, I just want to thank you all for that. And from myself and everyone at IBTM, thank you for joining us today. This webinar will shortly be available on demand on the Connect website. And just to mention that the next IBTM webinar will be taking place on Wednesday, 29th of July, where Rob Davidson, Managing Director of Mice Knowledge, will be discussing the unbeatable power of face-to-face events. Thanks again for joining us.